Traditionally, there's always been government NHS braces, but this year the NHS is having a bit of a problem with funding, so they're not able to provide the same range as they always have. What's going to happen is the teenagers with the teeth that are the most wonky will get the braces, and the teenagers who don't have such a big problem won't get it for free. This is a change that's just happening now, so it's the right time for some information to go out to families and to teenagers so that they can do some research and really find out what suits them the best.
The main things that people look at when they're communicating are, your eyes and your mouth. And if you're called names from either your friends or your family members can also, they maybe don't intentionally name call, but they maybe are making fun, but it affects people very deeply. And to be able to smile freely, it's just a weight off people's mind, or they can just smile, be themselves, and really let their personality shine out and forget about it.
We've just recently treated a 9-year-old girl who was getting bullied at school because she had very prominent teeth, the sort of Bugs Bunny shape, and then you can obviously imagine what other kids would, the type of comments they were making with that. So she was actually very nervous, timid, and after about 6 months of treatment and repositioning her jaw, growing the lower jaw, giving her a fuller smile, she's now a very happy, very confident child.
There are times when the teeth are crooked, and it's not just an appearance thing. The crooked teeth can affect your bite and how your teeth fit together. And if your teeth are not fitting together properly long term, then you can have teeth that chip or break. You can experience headaches every day, or you can wear the jaw joint away and get facial muscle pain.
Basically, I had an underdeveloped jaw and my mouth was quite crowded the way my teeth had formed, and it was causing a lot of health problems. I had migraine and I had a bad posture. It was all interconnected, and also the appearance of the teeth as well. They didn't look great and it affected my confidence. So that was my main motivation.
I think braces are a great idea. There was no hassle at all. It wasn't sore, it wasn't like you couldn't feel it, you got used to it. It actually felt weird when they came off, really weird. Once you have them on for a month, 2 months, a year, any fears or doubts you had before, they'll sound almost stupid because they're so exaggerated. There's really no need for any of it. So.
I wouldn't go back and change it for the world. I'm really excited about how my teeth are going to look at the final result, and it doesn't really hurt either, so it's definitely something I would recommend.
A lot of the braces now, the modern braces, use low forces on the teeth, so they're pushing the teeth very gradually into position, and that is much more comfortable for people. For the train track braces, you can get clear brackets that stick onto the front of the teeth and sort of tooth-coloured wire that will help improve the appearance. Then there's the whole range of braces through to the clear braces that really are very invisible, and you may not know that somebody is wearing an invisible brace when you're speaking to them.
And it's also possible with some of the removable braces we have to put little colours or designs in them. So we can show them a chart and they can choose what they'd like to have, whether it's a logo of a football team or a musical note or a sparkly brace. That can all be done just to help the child be put at ease as much as possible.
I would clean your braces after every time you eat. Obviously morning and night when you're brushing your teeth you'll clean your braces thoroughly, but if you're sort of snacking in the day, if you can get a chance, it's good to clean them after you've eaten.
Some treatments can be even as fast as 3 months, 3 to 6 months. If the teeth are very out of alignment, then maybe it would take up to a year to 2 years to complete the treatment.
You kind of watch the patients go through a journey from maybe being in a position where they're in pain, or they're not happy with their teeth, or they're maybe not that confident about something to do with their teeth, through the process of getting it fixed, and then maybe seeing them bloom a wee bit and be a wee bit happier at the end. So I love that.